Hello, my name is Jose Barrias. I am going to be speaking about the proper body mechanics and the proper form, the proper measurements for you to give an assisted device to a patient. You have to measure it correctly. For each patient, it varies because obviously they have different lengths of arms, different lengths of legs and torsos, and different heights, of course, right? The main one. Proper body mechanics and measurements of these assisted devices helps in preventing pressure ulcers, which can lead to more serious things, as in infections, because a pressure ulcer is like an open sore, so it can get bacteria and germs that will cause an infection and further make the patient more ill than better. So as well as proper body mechanics are also important because they do help you not strain any muscles or hyperflex or hyperextend. Hyperflex and hyperextend is where your body goes out of the normal range of flexion or extension, and that makes sure that you don't strain any muscles or bones or tendons, and that you're not feeling worse after using your assistive device. Many patients don't really take these precautions and just use family members assisted devices, like they hand-me-down canes, hand-me-down walkers, wheelchairs, which is not recommended at all because of course everybody's body is different. So what your dad that's 6 foot and you that's 5'10", even if it's 2 inches, it does vary if a few inches, so that you need to be measured anyway. It's not recommended at all to use a hand-me-down cane, walker, or wheelchair, crutches, any assisted device, which is a very big problem and in the whole world, because sometimes people don't have the right not the right economic status or enough money to get their own assisted device. So they do hand-me-downs, but always try to get your own. And I will be using my mom today. She will be my patient. I'm going to be measuring her I'm going to start off with a walker, and then I will do a cane, and then lastly, I do not have a wheelchair, but I'll still measure my patient as if they were getting a walker. As if they were going to order a custom-made walker. I'm going to measure them with a tape measure, which I'm going to use, and I'm going to describe what to do, how to measure them. And so yeah, let's right now I'm going to change position, but I'm going to go get with my patient, and I'm going to introduce myself and start some measurements. Okay, give me 1 second. Hello, my name is Jose. I'm your physical therapist assistant for today. Can you please take a seat? So today, like I said, I'm going to be measuring her width and the right proper body mechanics for a walker. So this is going to be a walker for her because let's just say she injured her hip or something, can't walk right. So she will stand up, and you always want the elbow should always be, when they're grabbing onto the walker, it should always be lined up approximately to the hips or to the ASIS, which is the anterior superior iliac spine, And in order to make sure it's at the right length, you would need to have at least an elbow flexion of at least 15 to 20 degrees. And that's the only body mechanic that you really have to make sure for a walker. It's really important that the shoulders are also lined up evenly. There's not one shoulder that is raised more than the other one. And yeah. And then I'm gonna now measure the cane, which is similar to the walker, just a different sort of form of assistive device. So, like you can see it's exactly the same elbow flexion, 15 degrees of elbow flexion. And it's also lined up with her hip or her anterior superior iliac spine, the ASIS. And it should always be like that. But another way that you can measure would be if you take away the assistive device and you make the patient straighten their arm. Just hold it down, not straighten, but just relaxed and how you would normally stand. The handle of the cane and the walker should be at the height of the crease of the wrist, where they usually wear like these bracelets and stuff for a watch, where you can see that crease in the wrist, and that's where the handle should be for that approximately 15 degree angle for elbow flexion. And then that's it for walker and cane. So now, like I said, I don't have a wheelchair, but I'm still gonna measure her the seat depth, seat height, seat width, and back height, and leg rests, as if she was ordering a custom-made wheelchair. So if you could sit down, please. I'm gonna adjust the camera real quick. Okay, so in order to measure the right seat height, you will have to measure, from the bottom. Usually the tables are a lot, physical therapy tables are a lot sturdier than this makeup physical couch, right? So to measure the seat height, you want to be measuring with a tape measure, and if it's a flexible one like this one, you want to make sure that you don't fold it or it doesn't have any. Just make sure that it's straight. So you have to measure from the back of the knee. If you could sit down 90 degrees. Measure from the back of the knee to the back of the heel, to where the heel ends. So for my mom, it would be around 13.5 inches. Like I said, this bed is not that sturdy, so it might vary on a real bed. But then for the seat width, the seat depth, it's gonna be from the back of the knee again to the back of the bottom, which in this case, it is gonna be bending a little bit, but you just have to make sure that you get the right measurement and hold it out straight as you can. So for this one, it would be about 17 inches. And you would subtract 2 inches from that so it does not cause any pressure ulcers on the back of the knee. And then the seat height, I forgot to add, you actually have to add 2 more inches for the seat height. That way you have enough room for the footrests. Now for the seat width, you want to measure, if you could just turn a little bit that way, from one side of the hip to the other one. And again, just make sure that it's as straight as possible. So you would, find the widest part of the right side and the widest part of the left side. And for my mom, it would be about 16 inches. But again, you want to subtract 2 inches because you don't want any pressure ulcers forming in this area here. And then for one more measurement, you have to measure the back height. For the back height, you want to be measuring, again, sitting down straight, and you want to measure from the axilla all the way down to the bottom of the lowest part of the butt, of the bottom. So you would find the under of the axilla. You can just relax. I'll find the crease right here, and then you measure to the bottom. And for my mom, it's another 15 inches, but you want to make sure to subtract 4 inches so you don't get any pressure ulcers once again underneath the axilla, which are, like I said, can lead to infections and further illnesses down the road. And so this is how you would measure the proper form, the proper measurements for body mechanics and preventive pressure ulcers for a walker, a cane, and a wheelchair. Thank you.